Welcome to the deep dive. Malaria, it's this ancient disease, but it's one we actually know how to prevent and treat.
That's right.
Yet the global goal isn't just, controlling it, it's eradication, full stop.
A huge ambition.
So today we're going deep into the latest WHO guidelines. We want to unravel the sophisticated and sometimes pretty surprising ways the world's tackling malaria now. Our mission: to pull out the key insights, the stuff you really need to know so you're properly informed on this massive global health effort.
Let's get into it.
Okay, so first off, mosquito nets. They're not just simple nets anymore, are they? The guidelines show they've changed quite a bit.
They really have. I mean, mosquito resistance to insecticides, especially pyrethroids, that's a huge challenge.
Right.
So a key shift is that WHO now strongly recommends nets boosted with something extra, either pyrethroid PBO or pyrethroid chlorpheniper nets.
Instead of the old pyrethroid-only ones?
Exactly. The PBO or chlorpheniper, they sort of counteract the mosquito's resistance. They make the main insecticide effective again. It's pretty clever, actually.
That is clever. And, it feels a bit counterintuitive, but sometimes the guidelines suggest we might be, overdoing it.
How so?
Like with combining interventions. You'd think indoor residual spraying, IRS, and treated nets would always be better together. More is more, right?
Yeah, that's a common assumption. But the strategic thinking often points towards focusing on either high-quality net distribution or high-quality IRS.
Not necessarily both everywhere. Why is that?
It often comes down to resources and implementation quality. Trying to do both perfectly everywhere can stretch resources thin, and you might end up doing neither very well.
Okay.
So unless it's specifically for managing resistance or in places with just incredibly high transmission, the focus is often on achieving really high coverage and quality with one main tool.
So quality over just sheer quantity makes sense. What about these spatial emanators mentioned for extra protection?
Right, spatial emanators, they release insecticide into the air, creating sort of a protective bubble.
Like a localized shield.
Kinda, yeah. They're recommended as a supplementary thing, an add-on, but there's a big but.
Okay.
They really depend on continuous high coverage, and they absolutely should not replace the core things like nets or IRS. They're an extra layer, only if the main defenses are already strong.
Got it. So we've covered nets and spraying. But the chemical strategies, using medicines before someone gets sick, that's where it gets really interesting too, isn't it? Chemo prevention.
Absolutely. This is about using antimalarials proactively. A great example is intermittent preventive treatment in pregnancy, or IPTP.
For pregnant women, obviously.
Yes, using drugs like SP-sulfadoxine paramethamine, it dramatically reduces anemia in mothers and infection in the placenta, protects both of them.
That's huge.
And we also see similar strategies for kids in high-risk areas. Perennial malaria chemoprevention, PMC, and seasonal malaria chemoprevention, SMC. These are targeted hits for the most vulnerable children.
Now, one area that sounds particularly complex in the sources is dealing with P-Vivax malaria. Those relapses, they're notoriously difficult.
They really are. PVVAX is sneaky. It has these dormant liver stages called hypnozoites.
Hypnozoites. Sounds like something out of sci-fi.
Well, they can hide in your liver for months, even years, and then wake up causing a relapse long after you thought you were cured.
Wow. So how do you stop that?
You need what's called a radical cure. That involves using specific drugs, 8 iminoquinolines like primaquine, to kill those hidden hypnozoites.
Okay, seems straightforward enough.
But here's the critical catch. You absolutely must test for G6PD deficiency before giving these drugs.
G6PD deficiency, what's that?
It's a genetic condition. If someone has it, those primaquine-type drugs can cause their red blood cells to break down severely. It can be life-threatening.
Oh, so that testing, that sounds like a major hurdle, especially in places with fewer resources.
It's a massive implementation challenge. Getting reliable, easy-to-use G6PD tests out to remote areas is tough, but the guidelines are crystal clear. You cannot do mass relapse prevention with these drugs without testing first. Patient safety is paramount.
Right, absolutely. Okay, and shifting gears slightly, vaccines. We now have 2 WHO pre-qualified malaria vaccines. Big news.
Huge news. We have RTSS and now R21. Both are really valuable tools against P. falciparum malaria.
So how do they fit into the bigger picture? Are they going to wipe out malaria?
Well, that's the crucial point. They aren't designed to interrupt transmission globally, not on their own.
Okay.
Their incredible value is in preventing illness and, crucially, death in young children, particularly in high-burden areas of Africa. They significantly reduce severe malaria cases and hospitalizations. Think of them as a powerful new tool focused on saving kids' lives, part of the overall strategy.
A life-saving intervention for the most vulnerable rather than a transmission blocker for everyone.
Exactly. It's a vital addition to the toolbox.
So with all these evolving tools, smarter nets, targeted drugs, new vaccines, what does this mean when a country is really pushing for elimination, getting down to 0 cases?
Well, as transmission drops, the whole approach shifts.
Yeah.
It becomes much more targeted, hyper-targeted, really.
How so?
Instead of broad campaigns, you see strategies like reactive case detection. So when a case is confirmed, teams go out and test and treat people living nearby.
Like a rapid response team.
Precisely. Or reactive indoor residual spraying, where they just spray the houses around a confirmed case.
Yeah.
The goal isn't general control anymore. It's stamping out those last embers immediately to prevent transmission starting up again.
A surgical strike, you called it earlier.
Yeah, that's a good way to think about it. Very precise.
This has been fascinating. Our deep dive really shows just how dynamic and frankly intricate the fight against malaria is. It's constantly adapting.
It really is. From next-gen nets to these very specific drug regimens and vaccines, it's a continuous scientific effort.
It truly highlights the innovation required.
Which leads to a thought, really, for you listening to this. Given all this complexity, the science, the need for strategies tailored to each specific place, what strikes you as the biggest hurdle or maybe the biggest opportunity in making sure these amazing tools actually reach everyone who needs them? Something to think about.